Once you have had your surgery, once you're discharged, a post-operative instruction pack is given, which will include all the emergency telephone numbers you need to ring if in case of any problems. Additionally, we give general instructions in terms of how to sleep, where to sleep, what to eat and drink, how to move around, how to shower, how to take your bath, how to change clothes. But by and large, once the surgery is performed, you should be able to do, pretty much most of the things normally, except very heavy lifting and heavy pushing. Although whether it will take 2 days to start doing light activity or whether it'll take 5 to 6 days depends upon that person. I don't personally restrict the arm movements. So I encourage my patients to start moving around, pottering around at home, taking it easy. They're not to do any heavy activities such as hoovering or moving heavy furniture and doing things like that. You can't drive, obviously, for insurance reasons until your wounds have been checked. It takes 7 to 10 days to heal, and most people will be healed by that time, although some people will go beyond 10 days as well. But the wounds will take about 2 weeks to become nice and solid. Initially, every single day you will see an improvement coming. So you will feel a little bit restricted and a bit in pain initially, but pain can be controlled very easily. One can give a long-acting anesthetic, as I do, and that can numb the breast for anything from 12 to 48 hours. And then what I prefer doing is giving pain relief, and 2 different kind of painkiller tablets are given, and you start taking them straight away. And that way, by the time the sensations come back, your body is already full of analgesic. So it is more of a bit of a discomfort rather than pain itself. But that is how pain is managed. Of course, we occasionally get a patient who will need much stronger painkillers, but generally speaking, most people are given brufen and paracetamol in alteration. They take it, and that suffices along with the long-acting anesthetic. Activities, as I said, light activities, fine. You can carry a small tray, carry a small bag, potter around at home. You can go outside 2nd, 3rd, 4th day. But really, it does depend upon each individual patient, how they will react and how they will move around. It depends upon their threshold of pain. It depends upon what support they've got at home. It depends upon whether there was any complication or not at home. And it does depend upon how they are and how they react to the surgery itself. But by 7 to 10 days, almost everybody is fully mobile and back to doing normal things. And once your wounds have been checked in 7 to 10 days, you can drive around and pretty much resume normal activity. If you were working from home, say for example, on a computer or doing things, you can probably start working on 2nd or 3rd day, sitting at the desk and doing normal things, or putting your laptop there in your lap and doing some things if you really wanted to. But normally I would advise is you should take a few days off and think of it as a small pampering holiday for yourself.